This conference will now be recorded.
And finally, the slides and the recording will be posted to our website either later today or first thing tomorrow, which is shp.com/webinars. And now I will be quiet and turn things over to Mike Scribner, who will be leading the rest of this forum. Mike?
All right, well, thank you, Aaron. Well, this is probably the most information-packed of these that we have done. There's a ton of information here, so we'll clip through it as quickly as possible. Matter of fact, there's so much information to go on that we decided to clip a whole bunch of it and move it into an appendix because in the PowerPoint that you'll see posted, we walk through the entire process that HHS has outlined for the reporting, and it was simply way too much to go over in an hour time frame. So we clipped it down to the part that I thought would be most relevant to you guys about who needs to report, how do you report, and getting at the expenses and the revenue side to the pieces of it where you actually justify the dollars that you got. And so with that, let's go ahead and dive in. It's here, not scary, but good. We're finally here. So the reporting requirements that they have posted now apply to all the provider relief funds that have come so far. It's the general and the targeted distributions that have come, nursing homes, and then the infection control distributions that have been made previously. The reporting requirements that we're about to talk about don't account for are not for the RHC COVID testing program. And then you see the uninsured program that you guys have been sending in the individual cases through the portal, or the coverage assistance fund. So none of that, those very specific funds are not required to be justified through this process. It's all the others all the other dollars that you guys have seen. Next slide. This is one of the probably most important 2 or 3 slides I think I have in here, or we have in here. My point is that there has always been this rolling set of FAQs that have kind of supported their guidance around all of this. And whereas they did issue some more guidance when they defined the timeline last Friday and all that, and we're going to go over that today, there are still several important parts of the expense reporting that I think are still kind of up in the air, and still some pretty obvious questions that need to be answered around that. The more of what you'll hear me talk about today, they gave more guidance on lost revenues and a little bit more specificity with that than they did on the expense side. And so they kind of just reiterated what was out there from that perspective. And so I guess the overriding point would be that, yeah, it is absolutely critical for you guys to begin getting ready to submit. However, because there's A, the portal isn't out there yet, and B, the FAQs are going to be rolling in over the next period of time now that they've issued this, I wouldn't get in a hurry to go try to get your submission in. I think between now and even into July and August, there's no question, there's going to be additional clarification that's going to come out. And so I just wouldn't be in a hurry. I think certainly to the degree those come out, they're going to be affecting how you pull together data, what you have to support it, what the documentation needs to be, what's allowable, what's not, all that kind of good stuff. All right, next slide. So when we're looking at the time frames, before it was pretty straightforward. There were going to be 2 reporting time periods and 2 kind of use periods along with it. So there was one where you were going to be reporting 2020 activity by June 30th of 21. And then we were going to be reporting 1/1/21 to 6/30/21 period activity by the end of this year. Well, now that they're acknowledging the fact that all the funds didn't come out at the same time and it's kind of spread out over a longer period of time, they are now, and I'm going to show you a chart on this with the next slide, that they're splitting up the dollars you received within a certain period of time within a deadline of when you're supposed to quote unquote use those dollars. And by use, I mean justify via expenses and lost revenues, and then a time period by which you need to report that. And so all of this is is based on acknowledging that there's even dollars that haven't been distributed today. And there are some of y'all that got dollars as of 3 weeks ago. And so it's spread out a lot longer than I think they initially thought it was going to. Now, that said, that last bullet point, due to the time frame, they don't expect that any provider will have incurred eligible expenses prior to 1/1/20. I doubt you would have thought that way, but they've stated that as a rule. Well, as a strong suggestion. All right, next slide. So what this is basically saying is that the first column is when did you get the money? The second column is what's your deadline to use it, and the third column is when do you have to report the information back to HHS, HRSA. So their first distribution was April the 10th, and that was that Medicare distribution that whoever was enrolled in the Medicare program got at the time. And so the first period is from April 10th to June 30th of 2020. Your deadline to use those funds and the reporting that is due, is about to be due now, is going to be related to the funds you got within that 2.5 month period. You need to have, quote unquote, used them or justified them by June 30th of this year, or 12 days from now. And then we need to submit it by September 30th of this year. And so kind of roll on down with a similar vernacular all the way through it, where some of y'all got dollars the second half of 2020. Those you have to use by the end of this year, this calendar year, and you have to report by first quarter of 22. And then you can just see the pattern on out from there. And again, like I said a minute ago, there are a number of you that I know got funds in their period 3 there. And so you have all the way until June 30th, 2020 to spend the money to justify the money, and then have to report it the next quarter after that. All right, next slide. Who has to report? It's anybody who received more than 10,000 in the aggregate during that time period that I was just referencing. So they're very clear to say if you don't report, then you are out of compliance with the terms and conditions that you signed to receive and keep the money, and you may be subject to recoupment. So there's no question that we do need to report and do the best job we can with. It's not just supporting the expenses and revenues. There's a lot of other information that they're going to be requiring through the process. So next slide. Continuing with that, who is responsible for reporting? It's broken down between the general and the targeted distributions. The general ones were that original phase 1 that was based on Medicare, and then the follow-up was based on a percentage of total revenue. And then there was that third phase that you had to input information on back in November that have been, those dollars have been trickling out since then. So all those, when I talk about who's responsible for when, that's under the general distribution. The targeted distributions, especially I highlighted the ones that are kind of more related to you guys, were for the COVID high impact, the RHC distributions that you guys have been getting, the ones specifically for nursing homes, and then the offshoot infection control pieces, the safety net hospitals, all of that kind of stuff. And then it will definitely account for the upcoming distributions. There is a quote unquote rural distribution that was appropriated in the American Rescue Plan, and that certainly will be a targeted distribution that will be added to that. But if you click to that next slide, basically all this is really saying is that it's the difference between whether or not a parent company or the actual entity needs to report. And I won't spend much time on this because I don't think it applies to too many people on the phone. But the basic upshot is that if it's a general distribution, the parent may report as a group for its subsidiaries. If the money was shifted up to them, you can report at the parent entity or report at the subsidiary entity. It doesn't matter. But for targeted distributions, because they were paid to a particular entity, the parent entity may not report. The actual receiver of the funds, even if you have a parent that you transferred the money to, the receiving entity has to be the one that fills out all the reporting and does the reporting underneath that. Next slide. The next slide is just to kind of summarize that and kind of restates the same points again about who needs to be the entity. And for most of you on the phone, you don't have a parent, so this is really kind of a non-issue to you. You're the one that needs to report. All right, next slide. There are several steps that they're asking for beyond just reporting expenses and lost revenues. One of the pieces will be, well, the main point, and they've been saying this all along, is that you have to use your normal basis of accounting. If you're under cash basis or modified cash basis or accrual basis, the method of reporting the expenses and the lost revenues when we get to that part needs to stay the same. You can't report lost revenues on a cash basis if your normal basis of accounting is under an accrual basis, which actually would have been a valid way to look at it, given some cash slowdown that occurred for a lot of you guys. That was slowdown of payments that occurred in addition to slowdown of volume at the time. But that's not an option because they're mandating that it's got to be our standard basis of accounting. So a couple of points. Any interest earned on the PRF payments, a lot of y'all got the money and stuck it in an account for a while. You're going to have to report on, and will be used as an offset. Whatever interest you earned on it will be an offset to the any losses or expenses that incurred. And so you'll have to report that if you dumped it into an account that was commingled with other funds, which didn't recommend it, don't recommend it, but if you did, you'll need to be able to calculate a segregation of the funds and be able to report the interest earned just on that portion of the funds. You'll have to report on any other assistance received. That's all the other kind of grant monies and everything else that you were getting at the time. PPP, the EIDL assistance, the ORH had grant funds, just any of those. And the forms will no doubt walk you through that process in detail. The use of the infection control money, and then the use of the general other targeted distribution payments. We're going to talk in detail about the rest of that. Then there's a couple new things which we don't have the details on, but they're going to ask for a whole bunch of patient and facility metrics that are going to have to be submitted along with the submission of the expenses and revenues, and then a survey that will be issued with the portal itself. Again, we don't have it, but as soon as we have it, we'll talk through the details of it. Next slide. So kind of walking back through there, they're very specific about the steps that you're supposed to take. And again, in the appendix, we walk through the whole thing. Not going to go through that right now, but there's, and again, I won't get into all the detail here, but the reporting entity overview, there's a subsidiary questionnaire if that happens to be applicable, whether or not you bought or divested entities during the pandemic, and the potential impact that might have on your submission, the interest earned, like I was talking about a minute ago. Another point that does still need to be clarified is the single audit access. And we'll talk about it a little bit, if you got more than $750,000 during this period, you'll need to have an audit of the use of the funds. And so that'll either be generated by what's called a federal single audit, or can be incorporated into your normal audit if you are a quote unquote commercial entity. We'll talk more detail about that. Then the step 6 to list out all the other grants, EIDL, business interruption insurance, anything like that you got, and then a separate set of infection control reporting that'll go with the package as well. But okay, all that said, to kind of go down to the next slide and kind of shoot to the crux of all this, I'll spend kind of the next 10, 15, 20 slides, 15 slides, to talk through what we know about what they're going to require in the reporting, and then what the FAQs have said about what are eligible and not eligible expenses. And some of this isn't new information, but now that we're up to kind of game time, we wanted to kind of go back through that. And so there are 2 major categories for the expenses. One is the general administrative expenses, and other are healthcare related expenses that are attributable to coronavirus. So basically what they're saying, the overall rule is that the expenses can be used to offset the payments if they were spent toward quote unquote healthcare related expenses attributable to the virus that another source has not reimbursed and are not obligated to reimburse. And so we'll walk through the examples here in just a second. But at the end of the day, the way this is going to work is that you're going to accumulate specific expenses that you believe either directly related to or have a portion that are allocatable to coronavirus. And then ultimately, you're going to offset that hunk of expense based on the additional revenues that you got to offset that PPP, EIDL, et cetera, et cetera. And so, for example, this first one, mortgage and rent, payments related to mortgage, rent, or facility. It's kind of obvious that if you rented a facility strictly for vaccinations or to do, do rapid testing or what have you, that would be applicable. What's a little bit harder is if you take a portion of your existing facility and you were temp checking and virus checking and have presumptive virus patients there, how to allocate a portion of that space to offset the PRF funds. There's not a clear question on that right now, and it's, again, part of the process should be to continue to ask those questions and monitor for the answers. So continue to walk through this. It's the insurance on those same pieces of property can also be applicable. The personnel, the workforce related activities to prevent, prepare for, respond to coronavirus during the reporting period, workforce training, staffing, temporary staff, overhead of employees, all those kinds of things apply. Matter of fact, there's some questions in the FAQ that even kind of go on to say, not only fringe benefits, but hazard pay and other things like that, as well as the supervision of prepping for it, like task force and oversight and all those kinds of things, that all of those can be considered to be incrementally virus related and, can be accounted for. I think the trick is going to be for those of you who set up separate ways to account for it in your payroll, as we were talking about many forums ago. If you set up a code for it and people have been dumping time to it and can document that, I think you're going to be in good shape. For those of you who did not do that and you're now looking backwards at trying to estimate portions of time of people that were doing all those various things, or even touching patients that you could presumptively assume were potentially virus patients. I think that the question is going to be, yes, that's true, but how do you come up with a reasonable allocation for that and then document that methodology to something that is auditable? And so, there will continue to be guidance on that, I'm sure, as well. Same thing holds for the fringes, because it's going to be driven by the time, but it's clear that they're going to allow fringes and hazard pay and all those extra things on top of it once you've identified the allocations of the personnel time in the first place. Lease payments, even up to software leases, especially if it's software specifically related to something to improve remote working environments, those kinds of things, that's clearly going to be applicable. Again, I think the question is going to be, how do you allocate existing costs that were used for the response or are still being used for the response, but how do you document that a portion of that has occurred? And again, same thing for the utilities, operations, portions of the facility, and then any other kind of general expenses not captured. The next category are the healthcare related expenses. That's the next slide, Aaron. This one it's intended to be more directly related, as in supplies, not necessarily year over year incremental, because I think that got clarified, but expenses that you can directly document that were related to either your response to your adjustments of how you supplies, the adjustments, how you treated patients, the extra cost for any of that related to the virus. Again, I hope you guys were accounting for that during the whole period, because going back to do this after the fact is going to be a pain for certain. Equipment, expenses paid for the purchase of equipment such as vents, updates to HVAC systems, negative pressure, those kinds of things. IT related expenses specifically related to EHR licensing, telehealth, those kinds of things. And then, like I said before, teleworking to support remote in a remote environment for some of your staff that were generated by the fact that the virus was here in the first place, or is here. Facilities, temporary structures, retrofit of structures, patient treatment practices, anything like that. There was a workaround, an additional facility expense, whatever, all that is applicable to apply as well. And then once again, their catch-all of anything else related to it. It's pretty clear to say that, you know, especially as you're dealing with the people who are involved, if a higher paid, you know, a medical director type or CEO type, their salary has to be capped at 197.3 for last year, 199.3 for this year. You cannot include an hourly rate for them that's in excess of that amount of pay. So shifting from that back to kind of reviewing some of the, next slide, reviewing some of the FAQs that we've had from the past. And a few of these are new and a few of them are kind of restating from the past. So we cherry picked, you know, 6 or 8 of these that we thought were the most relevant for you guys. So how do I determine if expenses should be expenses attributable in the first place? And their answer is sort of to restate, you know, the generic, it's, you know, it includes those same categories. However, it still comes down to, and I made this point 10 forums ago, they're restating the point that any expenses that you identify then have to be offset by sources received, including direct patient billing, commercial insurance, Medicare, Medicaid, et cetera, and other funds received from the federal government. I think it would have been fair game to say these are the incremental expenses, and then here's the offset as it relates to PPP, and you know, we got some supply money from ORH or what have you, but it's in here right now that any direct billing for COVID patients at least should offset. You can also read it like it's any direct billing for any patient offsets. And so I made this point at the time, and I just don't think it's been clarified, is that my last bullet point there, do we really have to offset all receipts from payers in this process, as in any provider that's currently profitable versus operating expenses? If your net revenues cover your operating expenses, do we now have nothing to report? I don't think that's the intention, but I haven't seen an FAQ directly hit that point. The other bullet, that third bullet right back above that, is that the PRF permits reimbursement of marginal increased expenses. And again, you can look at that 2 ways. One is that it's marginal, as in my expense category is greater than last year, therefore I can claim the increment over last year, and that might be helpful. But I think more directly, I think the intention should be that it's marginally, we have an incremental cost this year that I can identify, and that's the marginal versus having to compare it to last year. And so, you know, I think that you guys ought to run it both ways and continue to look at that. But I do think that's also a point that still needs to be clarified a little bit more concisely in their FAQs. Next slide. Continuing kind of reviewing the FAQs, what's included in funds for salaries and employee comp? Again, to the degree that this is the answer, is sort of making the assumption that you're down to incremental unreimbursed amounts only. But it is clear to say, and between this one and the next one, that it's not just their hourly rate, it's the fully loaded cost for that salary, for our employee who's being involved in those activities in the first place. And so, as I said before, the fringes and the hiring bonuses and retention payments and hazard pay, all of that is considered to be applicable cost, but it's within the confines of the fact that their activity in the first place is incremental or allocatable to virus activity in the first place. Kelly listened in on the stakeholder call from Tuesday, and they specifically asked a question on the call about hazard pay, which was whether or not that could be claimed. And the answer was yes. However, you have to have policies that were established for the distribution of that. You can't just declare a hazard pay bonus and let that flow on through. It had to be a policy that was established, and that policy was applied equitably across the organization, i.e. you can't just have, based it on one group of people that we thought were most at risk. Whoever was at risk needs to be covered by the same policy, and it needed to be applied equitably across those. Next slide. The next one is really to kind of get at whether or not it's just touching patients, or whether or not the task forces and all the group activities that you guys had to prepare for COVID and to respond to it and monitor your response to it, whether or not that type of activity that's not directly patient related, but was part of your response, whether or not it's applicable. And as you would expect, the answer is yes, that again, as long as, yes, it's attributable if it's applicable to that, to coronavirus, yes, but it has to be not reimbursed or obligated to be reimbursed by other sources, i.e. in this case, probably PPP. Next question down there, can providers use their provider PRF to pay taxes? And the answer is yes. This applies mostly to the private practices on the call today, that yes, they can. That if you held, because the IRS had previously said that the provider relief funds were taxable to physicians and to taxable entities. And so taxes paid on provider relief funds are considered to be part of the cost to offset those. So that, oddly enough, for the government, that seems fair. So that's the rule. Shifting on to capital, I know there's been a lot of discussion around this, and I will say my caveat to this is that there's still several questions related to this that need to be clarified. But these are the questions that have come through in our recent update from the stakeholder call. Do providers report total purchase price of capital equipment or only depreciated value? In theory, they're going to clarify it on that next question. But in theory, it's if you put in a piece of capital equipment that was either in response to the virus or was to maintain or increase your access to care during the response or during the pandemic period, then the relevant depreciation amount, not the whole amount, with the exception of what I'm about to say in just a second, that the relevant depreciation that would have occurred on your normal accounting methodology for it is what should within the period of time. So if we're reporting 410 to 41020 to 63021, it's the depreciation that would have been booked or was booked during that period of time under your normal accounting methodology. That's what you get to claim. Now, moving on to that next question, will it limit qualifying expenses for capital purchases to 1.5 years? The answer is pretty clear. It says that expenses for capital or inventory may be fully expensed only in the cases where the purchase was directly related to prevent, prepare for, and respond to coronavirus. My best example of this is one of our hospitals paved and added a covering to a facility to serve as their first testing and then their vaccination place. And that cost is, if put into service by 6/30/21, is 100% allowable, or should be 100% allowable if properly documented. If it was any other capital activity that was not specifically related to coronavirus, but was a general capital activity, then the normal depreciation that would have occurred during that period is what can be claimed. So it goes on to say that examples of things that are strictly coronavirus related would be ventilators and CT scanners and other ICU equipment that was put into use during the pandemic, and then kind of the normal inventory items that everybody was dealing with, all the PPE kind of stuff that has been out there. That third question, can providers include the entire cost of capital facilities? or will be limited depreciation. Again, it's the same answer where, again, if it's directly related, it's 100% of it. If it's related to access to general access to services, then the depreciation amount applies. Next slide, the update from the stakeholder call this week. There was a specific question again regarding the incident where construction is contracted for and the money is escrowed, yet that project is not completed and it's not ready to be placed in service. And what I quoted there was the answer, was that construction cannot simply be funded. It must be completed as well, as what they said on the call this week. Now, again, before you take that, they're clear to say that all the stakeholder questions need to be submitted as an official FAQ and get the response in order to memorialize the answer. And so that was a conversation, not a written FAQ, but that was their answer. And I know that's been a big issue for a lot of you guys. All right, next slide. This is mainly related to the hospitals on the phone. That cost-based reimbursement, how does that relate to it? The upshot of the answer is if the cost that's being incurred is an allowable expense for your cost report, to the degree the cost report reimburses it, i.e. the Medicare percentage of total or however you would go through that, then that is considered to be offset. And so you would need to include that as one of the offsets to it as you report through this process. But my last bullet is my caveat to that, which is remember that even if those costs are claimable, the Medicare cost reimbursement is not paying 100% of that cost. It's only reimbursing for traditional Medicare. So the remaining 80%, 75%, whatever that percentage is for you guys, would still be applicable. You don't remove it in its entirety simply because it's allowable cost on the cost report. Next slide. All right, so the next step in the process is exactly what you would expect. So you accumulate up all those expenses and then you offset it with PPP, whatever other revenues have to come, and then you offset it against, whatever is, cost report reimbursed for those of you, the hospitals on the phone. And now you're down to everything else is to be justified via lost revenues. And like I said previously, they did give some update to that. And so go to that next slide and we'll get at that. All right, they gave 3 options, and their number one point was the same as on the expense side. Can't pick and choose accounting methodologies within all this. If you were cash, modified cash, accrual, you got to still use that methodology for reporting lost revenues, just like for expenses. They gave 3 options. One is to look at the actual difference in patient care revenues, and we'll talk about the details of that in just a second, calendar year over calendar year. So it's 2020 versus 2019, or it's going to be for pushing out into 2021, it'd be 2021 versus baseline 2019. And so it's got to be calendar year before it's all said and done. Option 2 is to look at 2020 budget that must have been established prior to March 17, 2020. You can't go back and approve a budget later on. It must be established prior to the pandemic versus the actual revenues that occurred for that period of time. Now, the weird point here is that all of this contemplates a calendar year reporting, and yet most of you on this phone, on this call, have off calendar year. You have a fiscal year. A ton of 630s on here, some 930s, 831, 1130s that are on here. For purposes of doing this, it would be having to figure out how to take just the relevant months from the budget and compare those to the actuals for that period of time. And then the third option, which I'll talk about, and it wasn't explained in detail, was the third option is that we calculate any other reasonable method of estimating revenues, which leaves the door open for quite a bit, to be honest with you. But that was, and we'll talk about some theories around that in just a second. Clip on to the next slide. So as I was saying before, option one, well, with any of these options, we're going to need to, and we'll show an example in just a second. You'll need to submit quarterly patient care revenues broken down by payer, as it is on the bottom part of this page, by quarter 2019 through 2020 at least. And so that will be part of the reporting regardless of which methodology you use. One point that came out of the FAQs was that there is no limit to the portion of PRF justification that can be allocated to lost revenue, i.e., if you've only got 10% of what you receive justified via documented expenses, and the other 90% is justified via lost revenues, that's still okay, or at least it's not prohibited to report like that in the FAQs. It may give rise to higher odds of an audit, but there's no limit to the portion of it that can be justified through lost revenue in this process. So within all the options, again, the reporting pieces are all these reporting pieces are the same. There's a couple of add-ons for option 2 and 3. So total revenues is our equivalent of net revenue. Net charges reads to us like it's allowables, like it's not gross revenue, it's net of contractual adjustments kind of thing. And so one is your actual net revenue after bad debt comes out, and then the other one is a net charges equals allowables when all is said and done. And then within that, you need, and with all the categories, you're going to need to report those net revenues and net charges broken down by the payer mix down, the payer categories down below. Medicare, straight traditional Medicare, then the Medicare Part C or the Medicare Advantage stuff, then Medicaid and the CHIP programs, commercial insurance, self-pay, and then any other type revenues. And that's the way the format is set up. This is the next slide is just our take at what a spreadsheet might look like to capture this kind of information. Is at the end of the day, what you're really looking at is at the top of that page would be for option 1 at least would be to look at the quarter over quarter and then the annual differences between 2020 and 2019. Again, again, you're going to hear me recommend in just a minute. We think you ought to go through all of these plus dream up some option 3 versions and then just kind of think about what your final reporting ought to be. But this is what option 1 might look like. Next slide. Under option 2, where it's really actual versus budget, in addition to all the other things that I was mentioning a minute ago, you need to submit a copy of the budget, which again had to be approved before 3/27/20, and then an attestation from CEO, CFO, board chairman, something to suggest or to prove that it was established and approved prior to 3/27/20. One other question that we think needs to be submitted is if you're out into 2021 for the funds received later on or for the first 6 months of this year, by definition for you guys, the budget that's going to occur for January through June of 21 really couldn't have been, you didn't budget for that period of 21 on a budget that was approved prior to 3/27/20 for the most part. And so if that happens, then you do have that. But if for most everybody else who will not have established a budget, my guess is that applying 21 actual to that same 2020 budget to accumulate lost revenues into 2021 will be the answer. But I don't have that in an FAQ, and we'll continue to monitor for that or ask that question on our own. For this one, go to that next slide. It's the same format. This is just a populated version of it where the bottom section is now budgeted revenues, which you would have to report. Again, I know a lot of you don't really budget net revenue at the payer level. You would have to go back and take your budgeted net revenue and split it out under some methodology to get to this level of detail. But it's that level of budgeted budgeted revenue compared to your actual net revenue, and then accumulating the difference for 2020 to determine the applicable part to offset the PRF that you got. Next slide. The third one is where it kind of moves into the wild, wild west out of all this, that option 3 of the any reasonable method. It, again, the sentence I gave you before about that it's any other reasonable method that's about what's in there. And we'll send out to you the 11-page document that went with this, but there's just not a whole lot in there, and yet this is a brand new huge category of it. So it didn't give you a lot of guidance as to allowable methods, really no guidance as to allowable methods, nor did it define the applicable time periods, where the others, option 1 and 2, are clear to be calendar year based. It didn't define that. And so again, we think that's sort of part of how this category needs to be considered. And so a few things that we were thinking about relative to this is that one option would be prior year growth trend pre-pandemic versus the pandemic actuals, i.e., if from 17 to 18, 18 to 19, 19 coming into 20, you were running a 5, 6, 7, 8% growth rate, and into 20, you're flat or down 1 or what have you, that a method, one option would be don't take budget, which you might have been more conservative on. Don't take actual to actual. Take the rolling trend versus 2020 actual and see if that produces a larger answer. The second one was that you could look at it. It doesn't say that you even have to consider the entire entity. And so you could take the prior year growth trends for specific product lines that were most heavily impacted by the pandemic and apply those to those departmental or service type actuals for those similar services over time. And that might be an option. Third one that we thought of that maybe should be thought of is take the prior growth trend line again and apply it to actual, but then adjust for items that might have occurred in 2020 or late in 2019. I have a new provider that started in 2020. I have a new initiative or a new service that started in 2020, and it's not really pandemic related. And sort of to normalize 19 versus 20, I'm going to strip out the impact of that out of 20. Or a replacement provider, for example, where somebody left in 19, I wasn't able to replace them until 20, to normalize it like that. And then the last one was, and again, I'm just scratching the surface here, to look at 2020 versus 2019 actuals, and then normalizing either year for singular events that either artificially decreased 19 or artificially inflated 20. Cost report settlements, one-time grant receipts, I renegotiated a managed care contract at the end of 19, then I felt the impact of that in 20. And so, yeah, my volume was down farther, but some of it was offset by, an improved contract or some kind of one-time receipt, such that the year-over-year revenues don't show the full impact that the pandemic had. And so we think some creative thought around all that is justified, and that we need to think about how to do multiple versions of that as we think about it. Which kind of comes down to the next slide, or I guess the next two slides. The one downside of choosing option 3 is that not only do you have to submit all the documentation for the methodology and a narrative around all that, but it's clear that they stated straight out that someone using option 3 may face an increased likelihood of an audit for the methodology. Again, I think it just means you need to well document any methodology that you select one way or the other. But what could happen is that if you select option 3, it's not like they're going to throw it out and all that's going to be done for. It's that if they don't like what you select for option 3, they'll kick it back to you, and then within 30 days, you have to resubmit option 1 or option 2, is the upshot of it. Which leads to the next slide. Yes.
Mike, I was just going to say that that's why it's so important to run it every single way prior to any submission.
Yeah, which is a really nice segue into the next slide, which was kind of from our perspective, we would run option 1, option 2. In my mind, we would dream up 2 or 3 ways to run option 3. And then there's no question if option 1 works, if actual over actual works and justifies all the PRF funds, you're done. If option 2, if not, move on to option 2. And if budget versus actual doesn't get it, then you're moving on to 2 or 3 versions of option 3. And again, it's not to say that you're just trying to cherry pick and game the system. At the end of the day, you would understand the risk that you're taking by going with option 3, and you'd lay out the multiple alternatives and see what you've got, and pick accordingly. All within the context of the fact that I fully expect that there's more option 3 clarifications that have to be forthcoming. You can't leave that entire section open to 2 or 3 sentences where it's open to this kind of interpretation before it's all said and done. Next slide. All right, pivoting all the way out of that, the last couple of things that need to be reported that are brand new, or that there will be reporting metrics added that are going to hit at personnel metrics, total number of clinical, non-clinical personnel, broken down by labor category, patient metrics, number of admissions, outpatient visits, facility stays. There's some FAQ that gets at the detail of that as well, and some definitional stuff around that. And again, more of that will get clarified as the portal opens and we know exactly what their form looks like. And then some facility metrics like staff beds and those kinds of things. The next slide, step 13, is a survey that's gonna accompany all the rest of this. That will be a survey of operational solvency and patient care issues during the crisis, and you see the categories they're going to require some feedback on: operations, solvency. I won't read them to you, but those kinds of things we'll need to fill out all that kind of information. So next slide. So what's next? The portal is officially going to open 7/1, but again, I would highly recommend that not planning to report immediately. Do think there's a lot of clarification that's going to be coming. Please give us FAQs that you have. We're going to be generating our own. We already have the 4 or 5 that haven't been clarified that I've mentioned to you here that we think are critical, but we need whatever you've got. We'll submit all of them, and we'll try to follow them through to get answers on all those. We think it's critical to go ahead and attempt to take our best understanding of this and try to run what you think are the incremental allowable expenses, and then run through all of the options for lost revenue and come to a place of your best shot of what we think it would look like under the varying methodologies that are available to us right now. And so we think that's critical. I wouldn't be ready to submit it yet, but we think that walking through the process and getting ready to submit, and at least understanding where you think you are versus the PRF that you got, is critical. And there's no reason that you had to wait to now to do it, but if you haven't done it already, we certainly would encourage you to do that. And for those of you, we'll be getting with whoever wants to one-on-one talk through this individually to develop that methodology. And we're going to move back into a regular forum schedule now that the bomb has dropped, and keep giving everybody updates to this very frequently. Now, change all the way from the reporting out to a little tiny update of the last slide here. There is some more provider relief fund incoming now. Whoever, again, input back in November, some phase 3 distributions have occurred as very recently, and they haven't been small amounts. And so please be on the lookout for that. And if you applied for it back in November and never got that notification saying you weren't going to get anything, and yet you haven't gotten money, then we need to talk about how you ask, how we pose the question back to HHS to get a response for you. In addition to that, the rural health clinic testing and migration program began last week, and you see that $460 million was distributed to 4,600 RHCs, 100 grand apiece, through all of those guys in order to maintain and increase testing, expand testing, that kind of thing. And then I guess the major point is there is somewhere between 15 and 20 billion left over from all the previous rounds, And then there was $8.5 billion added under the American Rescue Plan, of which $1 billion has been distributed. So somewhere around 20 billion is left to go. And so we believe that sometime over the summer that the methodology for that next round should come out. They were clear to say that a portal will open. Providers will need to input their information on there. Don't know what the methodology will be for distribution. Don't know what the qualification will be, but it was clear to say that there's another rural provider round forthcoming. Next slide. Okay, I guess that's it. I know the one question we had was, pretty please throw the PowerPoint out there, and we certainly will do that. But does anybody else have any questions that we need to go over? And I know that was a lot, so apologize for that. But it's a.
Mike, did you talk through what's in the appendix?
I mentioned it quickly, but basically what's in the appendix was our walkthrough of all of the steps required in the whole process and more detail about each one of those to try to help you guys kind of get your head around the whole survey. Anything to add to that, Kelly?
No, just a reminder that the PowerPoint recording and the PowerPoint itself are all going to be loaded onto the SHP website, so it will stay accessible there.
Very good.
Including the aforementioned appendix, that will be included. And it looks like, Mike, we do have a question in the chat.
Yeah, I see it. If you're using 2019 versus 2020 to show lost revenue, will you still be able to show expenses used in 2021? Absolutely, yes. The rule around expenses is clear. It's 410. If for money you got from 410.20 to 630.20, your applicable expenses push all the way out to 6/30/2021. But what is still a little bit unclear is because they're taking such a calendar year look at lost revenues, that what do you do with that first 6 months of 2021? Previously, it looked like you were going to baseline it against 19 under their old guidance, but you could take first 6 months of calendar 21 versus first 6 months of calendar or first 6 months of 19 and use that as your basis for lost revenue. I don't know. It's clear on the expense side. Not sure how this plays in on the revenue side, the lost revenue side. Good question. Thank you. Okay. All right, Aaron, I will hand it back to you.
Okay. Well, thank you, Mike. And yes, that was a lot of information. If you want to rewatch this recording or download the slide deck in its entirety, you will be able to do so either later this afternoon or first thing this morning. GoToMeeting can sometimes be a little slow on the upload, and that is shpllc.com/webinars, shpllc.com/webinars. We will, as Mike teased a little bit, be having some more webinars over the summer, so they will be posted there to the website, so stay tuned for that. Otherwise, I will give you 5 minutes back to your day. Thank you, everybody, for attending, and you have a wonderful weekend.
Thank y'all.